ED and TRT. A lot of patients start TRT to fix their ED, but testosterone does not always fix or improve ED. So explain a bit about that.
So that's also another important question, because first, I'm going to look at it from two different ways. First, there is what I call testosterone shaming. A lot of guys don't see their doctors for any reason. So they'll only try to see a doctor if they've seen that their sexual performance or their vigor changes. This is when they will be like, oh my God, I need to see somebody. They've never checked their blood sugar, cholesterol, but once it doesn't work down there, they need to see somebody. Yeah. So we get those patients who come in, they have decreased libido, decreased erections, testosterone's on the lower side, and then we come up with a plan for them. But on a lot of guys who are on testosterone or who are even considering testosterone, they have what I call T-shaming, because they feel like if they're on testosterone, that means they have ED. So it's kind of a badge of shame. This is changing a lot. And this is something I want to do, you want to do, that testosterone is not, I went on testosterone because I couldn't get it up or I was weak. Testosterone has improved a lot of things in my life, including the sexual side. But I'm trying to decouple testosterone and just sexual power and sexual vigor because there are so many other benefits of testosterone. So to go again over the example of the guy I said who's coming to me, and for him, decreased erection, ED, whether it's mild or severe, is a big problem. So the way we go, we know that testosterone does help with sexual function and sexual desire. So the first thing to do on a patient like this, if his level's on the lower side, is to optimize the testosterone levels and to get them into upper limit of normal and see what's going to happen. With this, it depends. It depends on the health of the patient, but anywhere from 30 to 60 or 80% of guys will have an increase in the strength of their erections, increase in morning erections, increase in desire for sex, and increase in satisfaction of. But then you have the guys that get all the benefits from testosterone, like I said, the mental benefits, the power, the body benefits, but the erections are still not getting there. And that's where we go into a gradation type of treatment. So what I usually do, we optimize testosterone. If you get good results, perfect, you're good. If we're not there yet, then we add low-dose daily Cialis. A lot of our patients, and I know you've talked about this many times on your channel, all the benefits of low-dose Cialis, for as a vasodilator, for better muscle growth, better vasculature, and it is FDA approved for better prostate health. But testosterone and low-dose Cialis gives us another maybe 10 or 20% of patients who are now I'm good. Now, let's say you do those two things and you still are not getting great results. There's new techniques now. I don't know if you've ever heard of Gainswave, the shockwave treatment to the penis. We do that in my office. It's an incredible treatment. Now, let's say we already did those two, you're not there. We add this to the treatment. Now you have more chances of getting better results. And there, about 60% of patients get a stronger or thicker erection and more sensitivity around also. So that's another treatment we can add. But I'm going to tell you, we've seen patients that we've done all this. Optimized testosterone, daily Cialis, they did Gainswave. Another treatment that is great also that I'm going to start doing, it's either PRP, penile injection, or stem cell or exosomes injection into the penis. That's another level that you add to try to get the erectile function better. But I've had patients who've done all this, and erection is still not great. And imagine when men go through this, it is a very difficult thing to see because it's really, the guy's trying, but this is what we talked about before. This is the effect, a lot of what we're seeing with the endocrine disrupting chemicals, that testicular dysgenesis model like we spoke about, because there is no question that we're having a very, very difficult problem with erectile dysfunction. All over the world, in the US, we see that significantly. I've talked about those companies before that are a telehealth platform, and then they send you Viagra at home. The average age of the patients who order Viagra in those clinics is 27 to 28. 2 generations ago, we didn't used to see that. So to me, that shows that there is a problem. And eventually 30 to 40% of people do not respond to PDE5 inhibitors like Viagra or Cialis. So it is sometimes a downward spiral of erectile function. Where can we break the cycle and have it go back up? Like I said, it's all those different things. Optimizing testosterone, daily Cialis, gains wave, P-shot, or exosome injection. And now, even if you have all this, and that doesn't work, which we see a lot of this is when we go into more drastic measures. For example, trimix or bimix injection into the penis, the corpus cavernosum. This is a really good treatment that for some guys, that may be the only thing that works. And I have a small proportion of patients in my clinic that we did all the interventions for erections, and we weren't able to get them there. So trimix is something that helps. But the most important thing for me when I talk to my guys, I'm like, I tend to have, again, that resilient mindset. I tell my guys, we have enough technology, enough science, enough treatment that no matter what is the cause of your lack of erections, we can help you with this. Even if you have to go down the treatment where you need trimix injection, or even if you need a penile implant. I have a couple of good friends in Miami who are urologists. Did you know that the penile implant wait list for some of those busy surgeons is almost 3 months?
Yeah, no, unbelievable.
So I didn't even realize that. So
Yes.
Again, so it is happening. There's a lot of guys, unfortunately, that whether it's because of diabetes, prostate cancer, so many reasons, or the unknown reasons, which I think the EDCs play a big role, that despite doing all of those interventions, they get to that stage. What I tell my guys is wherever you need to be to get great erectile function and have a happy sex life, do it. And do it with a positive mindset. Do it with a can-do attitude. No matter what it takes to get there, you can get there if you find the right doctor to help guide you so that this does not become anymore a crutch in your life. Because we know a lot of guys like this. They almost become either asexual or they decided not to have this anymore because it creates so much stress, so much anxiety, the performance anxiety. So it really holds you back. When you feel fully optimized, fully sexually optimized, and you enjoy a great sex life, you achieve more in life because we are sexual animals. There's no questions. So again, just to recap what I just said, testosterone likely will improve your desire, most likely, will likely improve the strength and recurrence of your erections, may not also, and if it doesn't, go down that list and see where you need to stop. But no matter where you need to go, help fix that. And be open with your partner also. That's something that's very important. I talk to my guys a lot also, is be open about it. Unfortunately, there's some crazy things happening in this world that we're not even sure yet. You know, we've talked about this. We're living through an experiment now where they're dumping 80 million tons of pesticides a year, 120 billion tons of plastics a year. How much? What was the numbers again? I think 150 million women on birth control pills, and that estrogen is in the water that we're drinking. So our testosterone is being attacked from so many places that sometimes you can have a side effect of it, and you don't know where it came from. All you know is you have the end result of the dysfunction. If you have this, what I like now with what I'm doing, I can help fix it, whether we need one intervention or whether we need to throw everything at you. Yeah. We can fix it.